Hi, my name is Alexis Fenster, and today I will be showing you how to properly perform an empty can test in order to assess the supraspinatus tendon. This test has a sensitivity of 52% and a specificity of 68%. To start the test, I'm going to have my lovely assistant Christina come up. Hi, Christina.
Hi.
So starting this test, the patient can either be sitting or standing, and they should have their arms fully extended, and they should flex their shoulders until they are at 90 degrees in the scapular plane. They should perform internal rotation of the humerus and pronate their hands so that their thumb is pointed towards the ground. And they should have about 30 degrees of horizontal abduction. For the examiner, she should have one place on the shoulder girdle for stabilization, and the other hand should be placing downward pressure on the superior aspect of the distal forearm as the patient resists this downward movement. This places the supraspinatus tendon under maximal stress as the arm is being pushed down. A positive test is significant pain and or weakness on the injury site. A finding of pain alone is less accurate than finding weakness, as pain can be the result of supraspinatus tendinosis or other injured and or inflamed structures, while weakness shown during the test indicates that the supraspinatus tendon is weak, impinged, or partially or fully torn. With the positive empty can test, one cannot distinguish if pain is due to supraspinatus impingement or tears, which is why the full can test is recommended. It is less provoking of impingement symptoms. The full can test does a better job of isolating supraspinatus activity. To perform this test, I'm going to have Christina come on back up for me. So Christina's going to start in the exact same way she was before, standing for me with her shoulder at 90 degrees of flexion. She's going to be 30 degrees of horizontal abduction, but this time her thumb is going to be pointing upwards. So the examiner will do the exact same thing. We'll have one hand stabilizing the shoulder girdle and the other hand on the superior aspect of the forearm. And I will be applying downward pressure as Christina resists this pressure. Yeah. A positive test would be weakness and pain in the subacromial region, but it can also sometimes be felt into the upper arm. If a patient does feel pain in either test, this does not automatically mean that they have a supraspinatus injury. Pain in the absence of weakness does not help detect partial thickness tears or tendopathy. If a patient does feel pain and weakness in the empty can test, this does not automatically mean that they have a supraspinatus injury, due to the fact that the supraspinatus is not completely isolated during this test, and some fibers from other muscles are also involved. In order to confirm a diagnosis of a supraspinatus tear, one should perform either an ultrasound or an MRI of the rotator cuff.